everybody. Thank y'all for coming today. My name is Courtney Miles, and I'm going to be showing y'all how to start an IV. Most people, when they go to the doctor, they're scared of needles. They're scared of the little bitty butterfly needle, and they're scared of the 16 gauge coffee stirrer needle when they go to the hospital. But the thing is just think about the benefit that an IV can do for you. Think about the lab work that helps you in the long run. When you go to the doctor, they can, if the doctor suspects you have diabetes, they can run a hemoglobin A1C, and that's 3 months. It can tell you what your blood sugar's been for 3 months. And if you go to the hospital, say you're dehydrated, it can hydrate you really fast. In a few hours, you're just like brand new. And also, if it's a trauma situation, you need blood, they can give you blood really fast. And as a nursing student, I don't get to start many IVs. I have started one. But we do practice sessions, we do check-offs, we read about it, we take tests. So I feel kind of confident that I can show y'all how to do it. So just remember, whenever the next time you go to get an IV or a shot or blood work, just remember that what the benefit will be for you. The first step in starting an IV is to palpate the arm and to find the best possible vein. If you don't have a good vein, then you can't start the IV, of course. We like to start distal. We don't like to start proximal. Proximal means closer to the heart. Distal is further away. So we like to look for the vein in the hands. We don't really like to use the hand veins because it's just not comfortable for the patient. We don't like to use the wrist for kids because of moving. But the forearm is pretty good. And also the AC, the antecubital, they use that in trauma situations, and in surgery they'll put like a large, like a 16 gauge needle, 18 gauge needle in your arm. Just in case you were to lose blood, they can get it in there fast. And also fluids, if you go to the hospital, you can get it in there really fast. Especially EMTs, that's what they start out with, is a large size needle to put in the antecubital. So the next step would be, once you find your vein, you're going to get your tourniquet. All right, and you're going to tie it pretty tight. Put it on there. You got to secure it good enough to where it won't come off, but just not too tight. Alright, so once you found your vein, there's a good one right there. I'm going to start right here in the AC. You got your cleaning supplies out. It just depends on what the hospital policy is. A lot of times they'll have their own little IV start kit, which is easy. Alright, and then I'm going to go ahead and get all my stuff ready. I'm going to go ahead and get my saline lock. This is what the hospitals use now. If I can put it in there. Alright, I'm going to go ahead and get it ready. Alright, and get my capital on. Alright, I'm going to be using a 22 gauge. First, I'm going to put my gloves on. I'm not going to leave that on there too long, I promise. You don't want to leave it on there too long. Alright, so I got my needle. I'm going to go ahead and take the cap off. And always be careful with the needle. Alright, so I got that. Alright, I'm going to clean. Nursing school says you clean back and forth, side to side. So that's what we're going to do. Alright, so, and whenever you're ready, you need to have your needle bevel up, and you have to do it for 10 to 30 degrees. So you don't want to go down, you don't want to go up. So you've got it in there. Alright, and once you get it in there, you're going to advance it. And once you see that blood return, you know that you're in that vein. So once you've advanced it, you pull the needle out, and all that's left in there is a catheter. Alright, and you're going to pop that tourniquet. So you've got that in there, and then you're going to stabilize that cath line. And then you're going to attach your saline lock. And then you're going to flush. When you flush, you're making sure if that vein is patent. And then whenever it's patent, you know you're good. Then you can hook your IV fluids up. Alright, so then you remove that. And then you stabilize it again with whatever the hospital has. Alright, there you go. Alright, and then once you've done that, you are ready to hook your IV fluids in. I'm not giving you fluids. Or whatever the doctor has ordered. It may be medication, it may be whatever. And then you would tape that up, and then you're ready to go. And then you make sure that your patient's comfortable. Make sure to always check the IV site, because if it's red, if it's swelled, then it could be infiltrating, and you don't want that to happen. So once you're done, just make sure the patient's comfortable and you're good, and you have to check every 2 hours. So just the next time that y'all go to the hospital, I hope that this helps. You know, sometimes knowing step by step can help you. It can ease your nerves a little bit. So just remember that the nurses aren't the bad people. The doctor's the one that writes the orders. Thank y'all.